Okay, so good morning to all of you. Now, Nafisha, you can start with your seminar presentation. Okay, are you ready?
Yes, ma'am.
Okay, turn on your video. Okay.
A very good morning, respected ma'am and my dear friends. My name is Napishisha Sundram and I'm from 3 years diploma for its 4th semester. And the topic that I'll be presenting today is on the progressive uremic encephalopathy.
I think you'll be able to share the screen now.
Yes, ma'am.
Yeah, you try to share.
Now the screen is visible.
Yes, it's visible. You can start.
So first of all, let us look into the keywords or the terminology of the topic. That is, by the term terminology, we mean it is a language that is used to describe a specific thing or the language used within a specific field. So number one, we have the term progressive, which means it is an example of something that would be described as progressive. It is a disease or illness that gradually gets worse, which means, like, for example, like diseases like cancer, diabetes, Alzheimer's disease and muscular dystrophy, etc. These diseases, when they are not treated at the early stages, they may have many complications and also they may be life-threatening. Number two, we have uremic or uremia. It is a condition involving abnormally high levels of waste products in the blood. Uremia is a dangerous condition that occurs when the kidney no longer filter properly. It is likely to occur when a person is in the final stage of CKD or chronic kidney disease. Uremia, it is a dangerous condition that it occurs when the kidneys no longer filter properly. It is likely to occur when the person is in the final stage of CKD. Encephalopathy, it is a disease in which the functioning of the brain is affected by some agent or condition such as viral infections or toxins in the blood. Which means that viral infections, they can be caused by the presence of a virus in the body. The various viruses can infect almost any type of the body tissue, from the brain to the skin. It depends on the virus and the person's state of health. The toxins in the blood, it occurs when some bacteria are in the bloodstreams, which leads to poor blood circulation. It may also be termed as blood poisoning. Next, we'll move on to the introduction. Uremic encephalopathy, it is an organic brain disorder or neurological change that we see in severe renal diseases. So when we talk about, when we look into the term neurological or neurology, we can say that it is associated with the brain. So it occurs due to the buildup of toxins, which are normally cleared by the kidneys. Normally, all the waste products or the toxins in our body, they are mainly cleared by mainly cleared or removed by the kidneys, by our kidneys. So if the kidneys, they stop working, there will automatically be buildup of toxins and many waste products in the body, which may be very dangerous. So it develops in patients with renal failure, usually when the creatinine clearance level falls and it remains below 15 ml per minute. Creatinine, it is, as we all know, it is a waste product that our body constantly makes during the normal muscle breakdown. Creatinine clearance is the volume of the blood plasma that is cleared, but that is cleared of the creatinine per unit time. So the normal value, as we all know, in male, it is 97 to 137 milliliters per minute, and in females, it is 88 to 128 milliliters per minute. So the patients with renal failure, they often have signs and symptoms related to fluid and electrolyte disturbances. Here, electrolytes, they are minerals that have electric charges, and it occurs when the levels of the electrolytes in the body, they are either too high or too low, that is, it fluctuates. And the electrolytes, it needs to be maintained in order for our body to function properly. Anemia, as we all know, it is a condition in which the blood does not have enough healthy red blood cells or RBC, which leads to reduced oxygen flow in the body. Malnutrition, it is the lack of proper nutrition. It is caused when we do not consume a proper and a healthy balanced diet. That is when our body lacks vitamins, minerals, proteins, etc. Bone diseases such as they are the abnormalities or the deformities of the bone, like rickets, which is most common and affects most of the skeleton system. And the gastrointestinal problems or the GI problems like constipation, food poisoning, gas, bloating, diarrhea, etc. These are very common causes of the GI. One of the complications of the uremic encephalopathy with the introduction of dialysis and renal transplantation, as we all know that dialysis, it is a treatment that filters and purifies the blood using a machine, or it is a procedure to remove the waste products and excess fluids from the body when the kidneys they stop working. And renal transplantation or kidney transplantation, it is the organ transplant of a kidney in a patient with end stage of renal disease or ESRD. The incidence and severity of uremic encephalopathy have declined, but many patients fail to fully respond to dialytic therapy. In patients with renal failure, encephalopathy is a common problem that may be caused by uremia. Thiamine deficiency, as we all know, vitamin B1, and this is and the deficiency diseases of thiamine. It is very common. It is also known as beriberi. It is caused by a poor diet or alcoholism. In dialysis, as mentioned before, like as mentioned earlier, that is it is a procedure of removing of waste products from our body by our kidneys. And transplant rejection, when the patient they do not want to get their kidneys transplant. And hypertension, as we all know, it's high blood pressure, fluid and electrolyte disturbances, or drug toxicity, which means that the toxicity refers to the poisonous or the harmful substance that can be in the cortex of the pharmacology. Drug toxicity, it occurs when a person has accumulated too much of a drug in the bloodstream, leading to adverse effects on the body. Moving on, let us see to the definition of uremic encephalopathy. So uremic encephalopathy, it is a cerebral dysfunction caused by the accumulation of toxins as a result of acute or chronic renal failure. Cerebral dysfunction or dysfunction of the brain, which ranges from complete loss of consciousness as it occurs in coma to disorientation and an inability to pay attention. Next, we have the etiology or the causes. So number one, we have accumulation of toxins. Toxins, they are harmful substances that are produced within the lining cells or organisms when there is too much of accumulation or build-up of the toxins in our body. We may find impairment to our body function, and it may also experience fatigue, skin rashes, or acne. And also there will be unexplained headache, constipation, diarrhea, etc. Next, we have alterations in potassium balance. The total body potassium is determined by the balance between potassium intake and excretion. Decreased pH. pH scale, it ranges from 0 to 14, as we all know, and the normal range is 7. And the neutral pH is 7. If our pH is decreased, it means that our blood is more acidic. because the strongly acidic, it ranges from 0. So an alkali, it ranges from 8 to 14. Acidosis, it is a condition in which there is too much acid in the body fluids. And then electrolytes, they are the minerals in our body that have electric charges. They are in our blood, urine, in our tissues, and other body fluids. The electrolytes, they are important because they help balance the amount of water in our body. The blood electrolytes like sodium, potassium, chloride, and bicarbonates, they help in regulation of the nerve muscle function and also maintains the acid-base balance and water balance. Intoxicants or drugs, they are used by some to escape physical or psychological pain. Overload from fluid overload, also known as hypervolemia. It is a condition in which the liquid portion of the blood is too high, which may be caused due to failure of the heart, the kidney, or the liver, or by intake of a high salt diet. Uremic symptoms such as fatigue, nausea, hypertension, itching, mental confusion, etc. Next, we have the clinical manifestation or signs and symptoms. Number 1, we have fatigue. Fatigue is feeling of tiredness with low energy and a strong desire to sleep that interferes with normal daily activities. Next, we have drowsiness. It is the excess feeling of sleepiness which may include alcohol or drug use, medication side effects, and some medical condition affecting the brain and the body. Next, we have vomiting. Vomiting means the ejection of matter from the stomach through the mouth, which may be due to food poisoning, motion sickness, overeating, brain injury, migraines, or appendicitis, etc. Next, we have lethargy, which means the lack of energy or the enthusiasm, which may be due to overworking, stress, boredom, or lack of exercise. Seizures, it is the burst or the uncontrolled electrical activity between the brain cells that cause temporary abnormalities in the muscle movements, or simply we can say that seizures, they are the abnormal shaking of the body. Next, we have hypertension. As we all know, hypertension is high blood pressure. And then edema, it is a swelling caused by excess accumulation of fluid in our body. Then memory loss, or it is also known as amnesia. We may not be able to remember or recall memories of the past depending on the cause or disease a person is suffering. A memory loss, it may be for a short period of time or maybe for a long period of time. And next we have coma. It is a period of prolonged unconsciousness brought on by illness or injury. Moving on to the diagnostic evaluation, we have the trial making test, which means that it measures as psychomotor speed. When we have uremic encephalopathy, it may result in the worst performance of the patient. Next, we have memory tests. Memory tests, like we usually have seen all these, like we've played all these games, I guess. Like suppose if the doctor may give the patient some cards like these, and he or she may be asked to, like the doctor may flip these cards and the patient may be asked to memorize these, whatever is in these cards. And after some time, he may ask the patient to recall whatever was in the cards. Choice reaction time test. It means the ability to respond or to react as fast as possible to what we hear, we see, or we feel. For example, a baseball fielder while playing badminton, then while playing tennis, etc. If we play badminton or baseball or tennis, when we do not, if the ball or the shuttle or the ball that we are fielding, if they come towards us, if we do not catch, it means that we can't even see the ball, which means that we may have some, we may not be able to respond as quickly as possible, which may lead to some of the diagnostic evaluation of uremic encephalopathy. Next, we have MRI, which means the magnetic resonance imaging. It is a medical imaging technique. It is used in radiology to form pictures of the anatomy and the physiological processes of the body. They use strong magnetic fields and gradients and radio waves to generate images and of the organs in the body. CT scan is also known as computed tomography. It combines a series of X-ray images taken from different angles around a body, and it uses computer processing to create a cross-sectional images of the bones, the blood vessels, and the soft tissues inside our body. Blood test, as we all know, it is a laboratory analysis performed on a blood sample that is usually extracted from a vein in the arms, typically for the diagnosis of illness or for the detection and measurement of drugs or other substances. Next, we have the complications. Neuromuscular irritability. It is also known as hypocalcemia. When this occurs when our nerves and our muscles, which are directly related to calcium levels, it may notice muscle cramps, twitching, and seizures. We've all experienced this. It is not due to an underlying disease, but then sometimes when we sleep at night, we usually experience twitching, which means suddenly our bodies tends to move. Next, we have drowsiness, which means excess sleepiness. Insomnia, which means the persistent problems in falling asleep and not being able to fall asleep at night. Inability to concentrate. When we do something, we are not able to concentrate or focus well on what we are doing. Seizures or epilepsy, it is the abnormal shaking of the body or a disorder in which the nerve cell activity in the brain is disturbed. Behavioral changes, that is like the transformation or the modification of human behavior. Peripheral neuropathy, it is the weakness and the numbness and the pain from a nerve damage. Usually we can feel it in the hands and the feet. Coma, it is the prolonged period of prolonged unconsciousness, and ultimately it will lead to death, which is, as we all know, it is a permanent, irreversible cessation of all the biological functions that sustain a living organism. Next, we come to the management. Correcting the metabolic disturbances. As mentioned earlier, that the electrolyte and fluid and electrolyte balance, it should be maintained, because we may have too much of some substances or too little of other ones that we need to stay healthy. So hence, we need to have a proper fluid and electrolyte balance, and also a balanced diet. Renal replacement therapy, it is also known as, it is a therapy that replaces the normal blood filtering function of the kidneys. It is used when the kidneys, they are not working. Renal transplantation, or kidney transplantation, it is a treatment of choice of the patient where the kidney can be donated from either living or deceased donors. therapeutic trial with RRT. Therapeutic trial, which means here RRT, it means renal replacement therapy. And therapeutic trial, it is designed to treat an illness or to improve a person's health rather than to prevent an illness. And last, we have dialysis. It is a treatment that filters and purifies the blood using a machine. This helps fluid and electrolytes in balance where the kidneys are unable to do so. Next, we have the prognosis, or it is also known as it is the outcome of a situation or a disease, or the chances of recovery or reoccurrence of the disease. Number one, we have the prognosis is generally favorable if the treatment is successful. So if the treatment is successful, so even the outcome or the result of the treatment, it will also be positive. With prompt dialytic therapy, the mortality rate decreases. There'll be a good chance of treatment, there'll be a success in the treatment, and dialytic therapy, meaning when we undergo dialysis, and the mortality rate, it is a state of being subject to death. Last, we have patient education. To ensure that treatment is initiated early, we should instruct the patient or the family members and the caregivers about the need for prompt medical evaluation when the mental status changes occurs. So the overall medical history and the current condition for the purpose of identifying the health problems, and also the assessment of the mood, behavior, judgment, memory problems, and solving ability, etc. Therefore, if the patient is under recovery of this certain disease, we should look for some of the symptoms that the patient is recovering, rather than just ignoring it, because if after being treated, then we should also have some positive effects that yes, the patient is healthy now, but still we should always ask the patient to not work too much, and also have adequate bed rest. Avoiding malnutrition and maintaining of an adequate protein intake and a low salt diet. Lack of proper nutrition, it is caused by not having enough to eat or not consuming a proper balanced diet. We may also instruct the patient with significant symptoms to continue bed rest. It is a low adequate protein intake. It is the satisfactory or the acceptable in quality, or the like some proteins like fish, eggs, milk, yogurt, cheese, beef, etc. We should always advise to have an adequate protein intake and a low salt diet. And also, we should always ask for the patient to continue bed rest, and we should also restrict, if he or she is taking a bed rest, we should restrict them from working too much. So that's all. Thank you. Thank you, ma'am.
Okay. You please turn off your screen share, Nafisha. Okay, now you ask them if they have any doubt regarding the topic. And
anyone, if you have any doubt,
turn on your video, Nafisha.
If you have any doubt, you may ask.
From the participants, say fast if you have any doubt.
Can you show the definition?
Yeah, okay. Here, uremic encephalopathy, it is a cerebral dysfunction that is caused by the accumulation of toxins as a result of acute or chronic renal failure.
Okay.
Okay, so you ask them the questions. Any 10 participants, you can ask them the questions.
Habak lang.
Habok lang, present or absent? Ask somebody else, they might have network issues also.
Ivaginia.
Hello. Yes.
Can you define the term uremia? Like, what do you mean by the term uremia?
Uremia is a condition involving abnormally high level of waste product.
Yes, okay, thank you.
Thank you.
Darshana,
Yes.
can you define the term progressive uremic encephalopathy? The definition.
No. You tell again. You tell again.
What, Darshana, কি বলা? What you said?
Aku ever cover this, ma'am.
Nafisha, you ask again. She didn't hear you.
Can you define the term progressive uremic encephalopathy?
नहीं मैंने बहुत आंसर को बोल दो एक बार मुझे नहीं पता
Ila Sarah,
Yes,
can you define the term progressive uremic encephalopathy?
it is a cerebral dysfunction caused by accumulation of toxins as a result of acute or chronic renal failure.
Yes, okay, thank you.
Welcome.
Malvina,
yes
can you mention the etiological factors of progressive uremic encephalopathy? Etiology.
Yes, accumulation of toxin, decreased pH.
Yes. Okay, thank you.
Welcome.
Kinisha,
Yes,
can you state some clinical manifestation?
fatigue, drowsiness, vomiting, lethargy.
Yes, okay, thank you.
Welcome.
Ishan,
Yes,
can you mention the diagnostic evaluation?
the MRI, CT scan.
Yes. Okay, thank you.
Okay.
Salam Girja. Tenkamchi. Hello. Rudolph.
Yes.
Can you mention the management of progressive uremic encephalopathy?
Pardon.
The management.
Management.
Say fast, Rudolph.
I don't know.
A rich person. Hello. Okay, Sheetal.
Yes.
Can you define the term dialysis?
Dialysis.
Yes.
It is a separation of particles of fluid from our body.
Yeah, okay, thank you. Srijana? Hello. Trishna? Shelly Hemam?
What happened? Why are you not answering? Krishna, Srijana and all?
Yes,
Can you define the term renal transplantation?
renal transplantation.
Yeah.
It is a organ transplantation of a kidney.
Yes. Okay, thank you.
Okay, Nafisha.
Welcome.
Yes, ma'am.
Okay. So I guess the topic is clear to all of you, right? So what you can do is, Nafisha, you can give your notes in the group itself. Okay, they can see the notes later. And about your presentation, I like everything regarding your diagrams plus the way you have explained. Okay, everything was good and you have prepared it very well. So everyone should do in that way only. Okay, many of you only read. Reading is not enough. You should have to explain all the lines properly. So Nafisha, your as a whole your seminar means it was very good. Okay.
Yes, thank you, ma'am.
Okay. So others, you all can give your attendance to your respective here, and now you can leave the meeting. Okay. Thank you.
Thank you, ma'am.